Welcome everyone. Today's training is centered on recognizing early signs of patient decline. We often view medical emergencies as like sudden events, but the data tells us different. So patients almost always give us those quote unquote smoke signals hours before anything happens. As bedside clinicians, aides, nurses, you are the hospitals or the doctor's primary early warning system. So today we aren't just looking at numbers. We are learning to recognize the subtle shifts in behavior and physiology that precede a crisis. So our goal is simple. It's to act during the golden window of decline so we never have to call a code blue. So you are the first line of defense, as I always say in my trainings, and your intuition is the most valuable clinical tool. So let's get started. So why it matters. Early recognition saves lives. Small changes can signal big problems. Delays in action can lead to emergencies, and you are the first line of defense. So let's look at some statistics. So, did you know that up to 25% of in hospital deaths are preventable with timely monitoring? Delayed response is a leading cause of complications and ICU admissions. Most decline happens hours before a crisis. And then at the bottom, I have another did you know, the golden window. Make sure you remember the golden window. Clinical signs of deterioration often happen 6 to 8 hours before a major event like cardiac arrest or ICU transfers. This is our window of opportunity so that we have a chance to intervene. What is patient decline? So patient decline is a worsening state, a measurable or observable drop in the patient's baseline of physiological or mental status. This can be sudden or gradual. Decline can be a crash or a slow sinking. Both require the same level of clinical urgency. This can also often be subtle at first. Those early changes are often behavioral or emotional before they become psychological. Next, we have general warning signs. This is when they're not acting like themselves, those behavioral changes. Increased confusion, this is that mental state. Agitation, restlessness. Their activity levels, which includes unusual quietness or refusal to move, refusal to eat. Those subjective feelings when the patients complain of feeling bad, not feeling themselves. These are some vital sign alarms. An increase in the respiration is often the very first indicator of distress. So you have elevated or low blood pressure. You have a decline in the oxygen level. Make sure you check their temperature. They have fever or abnormally low temperature. And watch the trends. Don't look at the direction the patient is heading. So just keep like a log. This is just a rule of thumb for me. Each time I am relieving somebody and I am just getting with that patient for the day, I always keep my own log because we can do reporting. You can tell me, what's what, but I assess the patient myself because what happens if, Jane is sitting with the patient and then here comes Mary to relieve Jane and she tells Mary, oh, well, she ate maybe 30% of her meal, but she feels fine. She answered all the questions. Cognitively, she's there. And overall, she's doing good. That's fine and dandy, but what if she leaves and then you happen to notice like a bruise on her arm or something, a scrape, or her blood pressure is low, or something like that. I always keep a little log for myself, and I check the patient out myself, because you don't want to just go on what somebody else says. So make sure you are looking at the trends. Check their vital signs. If that's in your scope of practice and your duties, check their blood pressure, and check it more than one time, because you're looking for those trends. So let's look at the respiratory signs. These can be very critical. We're looking for shortness of breath, labored breathing, which could be a sign of respiratory distress or increased work of breathing. This is when, they're using more of their accessory muscles. You might see the muscles in the neck, in the chest, or between the ribs pulling and retracting. So labored breathing, wheezing or gurgling, changes in their breathing pattern. Next, assess their neurological changes. Sudden confusion or disorientation, difficulty waking up, lethargy or lethargy, however you want to pronounce it, slurred speech or one-sided weakness, urinary and output changes, decreased urine output, which is oliguria, dark, concentrated urine, or no output for several hours. That's definitely a sign. There could be signs in their skin, like it could be pale, cool, or clammy skin. Cyanosis, which is like blue lips or fingernails. Now, a little tip, because I know you're probably looking at this like, oh, but what if they don't turn pale? What if I can't see any signs of cyanosis, like, blue lips or nails or something? If you are working with a client who has a darker skin tone, the things that you're going to look at is the oral mucosa, the inside of their lips, their gums. You're going to check their palms and soles. You're looking for any loss of the usual redness, that redness undertone. You're also checking their eyelid, like gently pull down their lower eyelid and check the conjunctiva. You're looking for, it should be a vibrant pink. Now, if it's pale, white appearance, that usually indicates like the poor perfusion. You can also look at their nail beds. You can still tell, by a tinge of blueness. So make sure you remember that. Sweating without cause. Next, we're going to discuss the red flag statements. These statements include, I feel like I'm going to die. Something is wrong. Or I can't breathe. I've never felt like this before. Trust your instinct. If your gut says something isn't right, it usually isn't. You know your patient best. Speak up even if you are unsure. And now, the escalation protocol. Knowing when and how to act to save lives. The triggers: sudden change in a condition. The immediate response: stay with the patient. Never leave the patient alone. Next, you have abnormal vital signs. Assess quickly and check for the red flags. You may have new onset of confusion. The response would be call for help. Activate a rapid response if needed. And trust your gut. If you have that gut feeling that something is wrong, report it immediately. Make sure you have all the information. Call the doctor, call the ambulance, call somebody. Report it clearly using the SBAR. So when to act, again, sudden change in condition. You see those abnormal vital signs. There's new onset of confusion. The breathing changes, and again, that gut feeling that something is wrong. So make sure you remember that, because that is on your exam. And what to do? Stay with the patient. Assess quickly. Call for help. Report clearly. Document everything. This is where the SBAR comes in. So let's look at the SBAR. The S stands for situation. This is a brief statement of the problem, like, why are you calling? Why are you calling me right now? So you would say, and you can use your own name, whatever field, whatever specialty you're in. Hi, this is Carrington on the Med-Surg unit. I'm calling about Miss Johnson in room 302 because I'm concerned about a sudden change in her respiratory status and level of consciousness. Next would be B for background. This is the clinical history and the context leading up to the current issue. Miss Johnson was admitted 2 days ago for post-op recovery. She has been stable and talkative all morning, but over the last 30 minutes, she has become unusually quiet and difficult to rouse. Now, if you are in a different setting, for example, you are an aide, a CNA, a caregiver at home, then an example of the background would be she's usually very alert and ate her whole breakfast this morning. However, over the last hour, she has become unusually quiet and is refusing to move out of her chair. And then the A and S bar is for assessment. This is what do you think the problem is? What's your professional evaluation of what you believe is happening based on your observation and your vitals because you're with that patient? So an example of assessment would be her respiratory rate has increased from 16 to 24 beats per minute, and her O2 saturation has dropped to 90% on room air. I believe she's experiencing early clinical decline and may be headed toward respiratory distress. Now, in another setting, I'll give you a different example because this may relate more to you. She just told me I don't feel right. I also noticed she's breathing faster than normal and her skin feels cool and clammy. Even though she doesn't have a fever, my instinct tells me that something is wrong. And then last, you have the recommendation. Like, what do you need? There's a reason you're calling me, which you told me the reason, but what do you need from me? What do you need me to do? And so I would say, I need you to come to bedside to evaluate her immediately. In the meantime, I am starting her on 2 liters of oxygen via nasal cannula. Now, of course, I'm speaking about this in, let's say, a hospital setting. And most times they do have like some sort of basic standard order. Otherwise, it's something that the physician has to order. But at this point, we can start her on 2 liters of oxygen. Now, in another setting, recommendation would be in a different setting. I need a nurse to come and assess Miss Johnson. Should I keep her in the chair, or would you like me to try and get her back in the bed? So that would be an example in a different setting. Trusting your instincts is a fundamental skill in healthcare because your gut feeling is often your brain processing these subtle clinical changes before they become obvious, like on a monitor. So as the sitter, as the provider, you spend the most time with the patient, making you the most qualified person to notice when they are simply not acting themselves. So something isn't right, say something. Speak up if you're not sure. You know your patient because you spend the most time with them. Now we're nearing the end of our training, which is always the best part. We're going to do some reviewing, test your knowledge. So scenario 1, Ms. Johnson is usually talkative. Today she is quiet and sleepy. Her respirations increased from 16 to 24. What should you do? This is an early decline. Increased respiration plus the behavior change equals an early sign of a crisis. So you're going to act now. Scenario 2. Mr. Lee says, I just don't feel right. His vitals are slightly abnormal. Do you wait or do you report it? Remember, the vital signs are slightly abnormal. And you're going to report it, of course. Report it immediately. Any change in the vital signs that are noticeable, you want to make sure that you report it. So here's a documentation example. Never just put the patient is not feeling well or patient not feeling well. You need a little bit more context. You want to put patient reports feeling unwell, respirations is 24, appears lethargic, provider notified. Just putting the patient not feeling well, that's subjective. It sounds like an opinion that provides no data, no type of measurable data for the next shift or the provider to act upon. In the next option where you see the patient reports feeling unwell, respiration 24, appears lethargic, provider notified, that's telling them that, okay, you've checked on the patient, you've captured the patient's actual statement, which is a critical finding, and then by you checking the respirations, that provides an early sign. That tells me he or she didn't just say the patient not feeling well. They actually care about the patient, because you should never just call the provider and say she's not feeling well. Okay, you have to give them something to go on. So stating that the patient appears lethargic then identifies, okay, you assess their neurological change. Think about it this way. When you document, we're painting a picture for the person who isn't in the room with us. So make sure you get all the details that you can. All right, we have a few more questions. So we're going to do another quick little quiz. Which is often the earliest sign of decline? Is it A, blood pressure drop, B, respiratory rate increase, C, fever, or D, pain? And the answer is B, respiratory rate increase. Question number 2. What should you do first when you notice a decline? Should you A, wait and observe, B, leave the patient, C, stay and assess, D, document later? And the answer is C. Of course, you should stay and assess the patient. All right, now some of the key takeaways. You can save a life. Early detection is the difference between life and death. Those small changes do matter. Trends tell a bigger story than just single numbers. So make sure you're looking at the patterns, looking at the trend of, for example, their vital signs. You want to act quickly and you want to speak up. Escalation is a standard care, not a sign of weakness. And this concludes our training. Until next time, you have a wonderful day and a wonderful evening.